Fowlers, you have PPE and you washed your hands, you're opening your sterile package and, oh, I'm sorry, I'm on the wrong thing. Not loud.
You don't mind if I record, right?
I don't care.
Okay.
Open, okay, open, I guess on the right side.
I'm watching your hand movement when I'm recording.
I'm sorry.
Are you recording?
Yeah.
Oh, so number 6, open sterile package.
I had to rip it.
Sterile saline. Well, we don't have sterile saline, right? We just have in our package. Make sure your saline is loose, right?
Shana, did you take her saline?
Are you recording right now? Like right now?
Stole it.
Yeah, so stop talking about
Okay, so
my
make
video.
sure that your saline is not
Just kidding.
expired. You would be palming the label, making sure it's not expired. Loosen the top to make sure that you'll be able to get it off with one hand.
Yeah, it's like tucked under.
Oh my gosh.
Why is it my sample feels
And then the next thing you do, once you open that up, you have clean gloves on?
Yeah.
You can put the drape on your patient if you
I
want
need
to do
gloves
that.
on right now?
You don't have to put
Okay.
the drape on the patient. As long, just make sure 1 inch border then for sure.
Mm-hmm.
And then drape it on your patient away from you, towards you.
Away from me, towards me. Million, how did you do that?
Like the watch. Watch.
Okay.
There you go.
That looks really painful for some reason.
My shoulder hurts really, really bad. I have to get shoulder
So it was
surgery
painful.
for me.
Kidding, it was painful then. All right, so then you put on, so then you have to manipulate, you have to put 1 sterile glove on, right? You're putting your sterile glove on your dominant hand.
I mean, you can pull this out so you got more room.
And then you want to
Dominant hand, right?
manipulate your sterile, so you have that hanging over your sterile field. You don't want that, right? So then you want to manipulate your sterile kit so that you have those trays. And again, you can wait till both sterile gloves are on to finish setting up, but you want to get the trays apart with the 1 sterile hand.
The only reason why we don't have the glove on is just to like open
Pour,
it up and
to be
pour,
able to pour,
right?
yeah.
Okay.
This is just for the water, right?
Yep.
This is on your 1 inch border, right? Okay, now reach around and get your container. You're leaning over your sterile field though, right? The sand.
I started over.
Palm the label, pour it into all of your the 2 trays. And put your sterile glove on, right? Once you're done with the water.
And then the cap is down.
Okay. Man.
I just realized that. I'm like, what?
So you would put the cap up, okay?
Okay, so.
Okay, and now I can put on my other glove.
And then, and careful, reach it over your sterile field.
At least you're catching like mistakes on the video, so you know.
Yeah. Okay, and now I can move everything around.
Yep.
Okay, so. And for now, put this in the water?
Yeah.
Yeah. And then these are used to dry. This is to
So then put your
tie.
other sterile glove on and set your kit up.
We're gonna have to get 2 wet total, right?
Yeah, 2 wet total.
This is to cover it up at the end. That would be within 1 inch borders, that was too far. This is to,
The cleaning, around the stoma. So those you can soak too.
I mean, you gotta go dig.
And then you can put them back in that tray.
Remember, when you get too wet like this, your field's not sterile.
I know.
So don't practice. And then get all 3 of those cotton swabs wet, and then put those right there. And then fold over.
and that one's to dry later.
Leave it there. container and maybe a little closer together, cause you're gonna wash in one and rinse in the other. So.
Okay, I think I'm good.
Sterile preference. Well, I have this one, the dirty one for.
So there you go.
So, because we're using this closer together, cause you're gonna go right when you clean the dirty, why have all that space between? I'd actually gonna do it.
So now we're going to unlock the cannula, drop in the saline,
So now,
and then start
well,
cleaning.
you have to clean that first, right?
So now we can take this off?
So now your left hand, your non-dominant hand becomes dirty. So think of that as dirty.
So we're gonna take it off, right?
Yep, and yours clips.
Yep.
This we would have taken it off before.
This would already be off,
Yep,
right?
that would be off
That would have been off before. Can you take it off, Crystal? So this would have been off during
And save
suctioning.
it, okay?
Okay, so this
Yep.
one comes off.
And these ones too,
Just-
sometimes you still
Oh,
can
I think my
pull
whole
it.
thing's coming off. Okay. And then this would go into,
That goes in your cleaning. You can just drop it right in if you'd like.
okay.
Good. And then, yep, so that hand only touches that. This
Yeah.
hand doesn't touch this. This hand doesn't touch anything.
Okay.
Got it?
Just cause you ended up spilling it so it's backwards, so yeah, that.
It's hard.
I know, I wish, we used to have really skinny ones and it was so much easier.
I'm not trying
'Cause
to
if
get
you-
water on you guys.
No, that's okay. If you push it through too far, you will have a hard time getting it back up. Does that make sense? So try to stop about here, just for your own sanity. Okay?
Now am I also washing this part too, or no?
No,
That would be done
just-
after?
Yep, I just
Okay.
worry about that.
And now I can dry it.
Nope, rinse it,
Rinse it. Okay.
rinse it out.
Now both of these are dirty.
Yep, now you have two dirty basins, and now you
Okay.
wanna dry it. Now what you could do too is just take your hand and kinda,
Get some water out
get
of it.
the water off.
Okay.
Don't blow on it.
Nope.
Don't hold it sideways like a cup and go making a noise with it.
Bless you.
No, I did my elbow.
And I would just do one pass, toss that, and you could use your glove thing.
Oh yeah, because it'll be sterile. I can't put it back on
Yeah,
here.
so I would just use, keep using them. And you can split them in half like that, like Debbie
Mm-hmm. get it
said.
thicker.
It just depends on, I don't like to do that, but it's not wrong to do it.
Okay.
Whatever works for you, and as long as you can get all the water off, okay?
Okay.
And then
Now-
that's done in your left hand.
Yeah, well, I would have gone
Okay.
for this part right now.
You can just start.
But like when we get to the gauze part, can we only use the sterile right hand?
Let me do it though.
Okay. Now I'm gonna move on to the Q-tips. I can do this all with a sterile hand, right?
Take that out.
Yep.
And we're gonna swipe. So you want to just stay over there?
In this part, I mean, try to do it as
So
sterile.
on the first one, we're gonna get under, right?
Yep, so this would have been.
Can I use my dirty hand to move it? No, right?
I will have to ask.
Angela, when I'm going back for my first swipe, I can't use my dirty hand to lift this up, right? To get underneath better?
Drop it in the water. Sometimes you gotta let it soak.
I guess you could. We try to have you not. So just
Okay,
try
I'll
to
try
do
not
it
to.
without doing it.
Pick it up.
So you're pretty much done.
Kinda try to get
sorry,
both sides of the
Jackie.
thing wet. I would lay it down like.
Debbie, is this how you do it?
Not at both.
No, we walk in, you turn on the.
Wait, what's this? Oh, this?
It's like 7 minutes long.
And then now the wet
gauze. We used to not always use the wet gauze, but you can do one swipe far towards you. Don't go back and forth.
Yeah.
Good, just one swipe and then toss.
Don't go into that end, it's the other end you go.
And then away, remember? Dirtiest away. Good, good, good.
Almost like wiping your period.
And then toss.
Right?
Yeah, far away, right?
Okay, now dry.
Now dry it off.
And then you don't
And
come.
this is not, now I'm gonna show you. Go ahead and do it. You're doing it perfect. Go ahead and dry it. Now flip
flip
it.
it.
Yep. There you go. It's got this, see? And then you're done with that part. And then you just have to get the sterile, the fenestrated gauze on.
Okay. So you said I can flip it like this.
Probably put a hair more water in. You can could do that,
Will you
but
be using those gloves even though they're dirty?
flip it over like I told
We
you.
still use this as one,
You wanna kind of
one process.
Okay.
If they were really, really disgusting, I would probably stop at that point and change it out.
so that you know.
But you did need to put sterile gloves back on.
And then you're using that
So it almost feels like I'm in Grey's Anatomy.
from the top and one from the bottom. And this could be your dirty too, because you're not going back for that.
I think you got in between the. And this is like bulky and not smooth. Does that make sense?
Yeah.
So that you did it fine. It's just how that is. Okay?
And then
Feel
after
okay?
that, I would clean up, leave the room.
Do your reassessments, whatever it
No,
tells you to
during
do.
the okay.
How do you feel? Okay?
So we're done now?
Yeah, what reassessments do we do?
Well, I don't know. Does this one tell you to? Let me see.
I didn't even see when you were saying to do the assessment the first time. I didn't even see where you
Yeah,
were
that was
talking
The
about.
assessment.
here. That was on the back sheet.
Which is
I'm gonna see because I'm getting used to all these new
Inspect
sheets
dressing
and
for
stuff.
coca, inspect
So
stoma for
place the
redness.
ties.
Now we wouldn't have any of that after we did that, right?
no, but that's why I think it's before, you know how it has that prior dressing?
Yeah, so we would check that prior.
Because when we're taking this, before we even start the changing or anything, we remove this with like gloves, and it's almost like the wound dressing. We take it off. We're checking, make sure there's no drain.
Yeah, so look at the drainage. Yep, you'd want to look at the dressing. Perfect. Yep, look at the dressing that you took off. You want to make sure it's not bloody or anything, or infection or anything like that. And then this one, the trach here, when you're all done, you really don't have any assessments to do. If you've done it all together, which we will in our checkoff, the only thing is that if you had to move that oxygen to clean, you
Put
just
the
have to put
oxygen
the
back
oxygen
on.
back.
Oh, that makes sense. Okay.
And I'd probably still keep the full socks on just to make sure. And then remember, just at the end of the trach here, you put the oxygen back on.
Oh,
Is that the way?
And having to move
Oh, hold
it
on.
a little bit. Make
Is that
sure
backwards?
those gaps are okay.
I don't have to put oxygen on my client.
Since we were messing with their airway.
There we go. And then full socks.
See how it's so much better